Welcome back to my channel, Doctor's Storyboard, and I am your own doctor, Dr. Saroj Sahi, and I am presenting DHA GP notes, the extracted version of Master the Board, and I hope you are liking it. If you are new to my channel, please like, share and subscribe so that you will get benefited for the preparation of DHA GP exam. So let's begin our notes continuously as earlier. Continue with lesson 13. Scleroderma has CREST. This is what you have to remember. They have calcinosis, R for Raynaud's syndrome, E for esophageal dysmotility, S for sclerodactyly, T for telangiectasia. Diagnostic test for scleroderma is ANA, ESR and SCL. SCL is the most specific test. And the treatment for scleroderma is methotrexate, ACE inhibitor for renal hypertension, PPI for GERD, CCB, that is calcium channel blocker for Raynaud's phenomenon, and cyclophosphamide for pulmonary fibrosis. Polymyositis and dermatomyositis. This is related to proximal muscle weakness and dysphagia due to pharyngeal muscle weakness. Dermatomyositis presents with malar involvement, heterotroph rash, edema and purple eyelid. Sol sign is seen in dermatomyositis, erythema, that is erythema of the face, neck, shoulder, upper chest and back. Gotron's papules, scaly papules on the back of the hand, especially proximal interphalangeal joint and metacarpophalangeal joint. Dermatomyositis are associated with cancer in ovary, lung and gastrointestinal and lymphoma. Diagnostics are CPK and aldolase initially, but the most accurate is muscle biopsy. Other ANA plus anti-JO antibodies. Treatment is methotrexate, azathioprine, IVIG and mycophenolate. Sjogren's syndrome, most common in women. Autoimmune disorder secondary to antibodies, predominantly against lacrimal and salivary gland. Presentation of Sjogren's syndrome: dryness of mouth and eyes, feeling of sand in eyes, that is keratoconjunctivitis sicca, thirsty, drinking water, dental caries, increased vaginal secretion. Diagnostics are initially Schirmer test, accurate is lip or parotid gland biopsy. In blood initially SSA, SSB. Rose Bengal epithelium is corneal epithelium, associated with corneal epithelium. Treatment is mouthwash, fluoride, artificial tears preventing corneal ulcers, pilocarpine, stimulation of saliva in mouth. And be careful about lymphoma. Schirmer test is done in Sjogren's syndrome. Just remember this. All vasculitis. Example: polyarteritis nodosa, granulomatosis with polyangiitis, vaginous granulomatosis gives fever, malaise, fatigue, weight loss, arthralgia, myalgia. Polyarteritis, small and medium sized blood vessels, that is arteries, associated with chronic hepatitis B, chronic hepatitis C are also associated. Diagnostic: biopsy of asymptomatic site, angiography shows abnormal dilation. Other abnormalities: anemia, P ANCA, ESR, CRP increased. Treatment is prednisolone, cyclophosphamide. Pain in jaw while chewing, giant cell arthritis. Treatment is prednisolone. Vaginous granulomatosis with polyangiitis. URTI with renal insufficiency. Diagnostic: ANCA positive. Treatment is prednisolone and cyclophosphamide. Pulmonary renal syndrome, also known as Horg-Strauss syndrome, associated with asthma and eosinophilia. Biopsy is most accurate test. Henoch Schönlein purpura, HSP. More incident, it's a kind of vasculitis. In GI system there is pain plus bleeding, in skin there is purpura, and in joint there is arthralgia, and in hematuria is in renal system. Biopsy is the most accurate test. Steroids are the answers if severe abdominal pain plus renal insufficiency is there. Cryoglobulinemia is associated with hepatitis C infection. In SLE, there is decreased C3, and in hepatitis C, there is decreased C4. Just remember this. This is the key point for MCQ. Behçet syndrome, associated with painful oral or genital ulcer in association with erythema nodosum-like lesions. Treatment is colchicine, azathioprine, cyclophosphamide, and thalidomide. Ankylosing spondylitis. Stiffness of back radiating to buttock, flattening of lumbar curvature, decreased chest expansion, enteropathy in Achilles tendon. Uveitis is found in ankylosing spondylitis. Diagnostic test is X-ray of sacroiliac joint, MRI. ESR is increased in 85% of patients. Treatment is exercise, NSAIDs. If insufficient, then the use of anti-TNF, etanercept, adalimumab. Psoriatic arthritis. Skin and joint involvement is there. History is psoriasis. Psoriasis is skin disease in dermatology, remember. And sausage digit. The finger digits looks like sausage in psoriatic arthritis. Please take a reference from Google picture for psoriatic arthritis. Diagnosis is increased ESR, increased uric acid level. X-ray shows penile in a cup deformity. Treatment: NSAIDs, methotrexate when NSAIDs insufficient, anti-TNF agents when methotrexate not used. Reactive arthritis, that is Reiter's syndrome, joint pain, ocular uveitis, conjunctivitis, genital urethritis or balanitis. Treatment is NSAID, sulfasalazine if NSAID not used. Diagnostic test for osteoporosis, DHA, okay? If T score is greater than -2.5, osteoporosis. If T score is 1 to 2.5, osteopenia. Treatment is vitamin D, calcium, bisphosphonate, denosumab, estrogen replacement, raloxifene, substitute for estrogen, teriparatide for newborn matrix, calcitonin decreases the risk of vertebral fractures in case of reactive arthritis. Septic arthritis, most accurate diagnostic: aspiration of joint, other WBC of joint fluid, culture of synovial fluid, gram stain, blood culture. Treatment is ceftriaxone plus vancomycin initially. Gonococcal arthritis is more frequent during menses. Presentation: rash, polysynovitis, tenosynovitis. Diagnostic: synovial fluid analysis, leukocytosis, gram stain, culture, blood culture. Culture site of gonorrhea: pharynx, rectum, urethra, cervix. CURP. CORP65 is in pneumonia. CURP is mnemonics for culture site of gonorrhea, that is pharynx, rectum, urethra and cervix. Treatment is empirical: ceftriaxone, cefotaxime, ceftriaxone. Osteomyelitis: Staph aureus is most common cause. Children get it from hematogenous spread, adults get it from contagious infection resulted from diabetes or vascular insufficiency. Salmonella is identified in sickle cell anemia patient. Initial test is X-ray, accurate test is biopsy. If X-ray normal, then do MRI and CT. Sensitive staph are treated with oxacillin, cefazolin, napsilin or ceftriaxone. Resistant staph are treated with vancomycin and linezolide. So now hematology, okay? So what I wrote in hematology notes in the beginning with the red color pen: febrile non-hemolytic transfusion reaction is equal to fever plus hemolysis. Clinical features are chills, rigor. Temperature is 38 degrees Celsius. If 39, then bacterial infection. CBC is the best initial test for anemia. Now the lesson in hematology, okay? The key points. MCV is the first clue to the diagnosis of anemia. Decreased MCV is sideroblastic anemia, thalassemia, iron deficiency anemia, anemia of chronic disease. Microcytic anemia has generally low reticulocyte count. Increased MCV gives low reticulo count, B12 and folate deficiency. Sideroblastic anemia, alcoholism, Anti-metabolite medications such as azathioprine, 6-mercaptopurine or hydroxyurea, liver disease or hypothyroidism, zidovudine or phenytoin, myelodysplastic syndrome. Methotrexate cross causes macrocytic anemia. Rheumatoid arthritis causes anemia of chronic disease. Fresh frozen plasma is not a choice for those with hemophilia A or B or von Willebrand disease. Cryoprecipitate is used to replace fibrinogen and FFP to replace clotting factors. Iron is absorbed in duodenum. Hepcidin level will increase in chronic anemia. Target cell are most common in thalassemia. Iron studies. Decreased ferritin is iron deficiency, while increased iron is sideroblastic anemia. Normal iron studies thalassemia. Chronic renal failure gives normocytic anemia, sideroblastic anemia, circulating iron level elevated. Genetic disease with normal iron studies, IDA, RDW in decrease. Sideroblastic anemia, Prussian blue staining for ringed sideroblast. Thalassemia, electrophoresis, but alpha thalassemia by DNA analysis. The presence of hypersegmented neutrophil in blood smears denoted megaloblastic anemia. B12 deficiency, high LDS plus high bilirubin plus low reticulocyte in effective erythropoiesis. Complication of B12 or folate replacement, hypokalemia. Excess copper also causes hemolysis. Sickle cell anemia manifestation, hypoxia, there is dehydration, there is infection, there is bilirubin gallstones, osteomyelitis, retinopathy, stroke, there is skin ulcers, avascular necrosis. Initial test for sickle cell anemia is peripheral smear. Accurate test is hemoglobin electrophoresis. Chronic kidney damage leads to papillary necrosis of kidney. How well gel bodies is found in sickle cell anemia? Remember, this is very important question and most common and popular question. Basophilic stippling, this is also important question. Sideroblastic anemia. Treatment of aplastic crisis, initially with intravenous immunoglobulin. The defect in the ability to concentrate the urine, isothenuria, sickle cell trait. Hereditary spherocytosis, treatment is folic acid, splenectomy. RBC binds to spleen, causes hemolysis, jaundice, splenomegaly, family history of anemia, bilirubin gallstones. Diagnostic test, low MCV, increased MCHC, negative Coombs test. Cryoglobulins are often associated with hepatitis C, joint pain and glomerulonephritis. G6PD deficiency is decreased production of glutathione reductase. Hence bodies and bite cells are found in G6PD deficiency. Paroxysmal nocturnal hemoglobinuria. Episodes of dark urine, pancytopenia, thrombosis is the most common cause of death. Treatment of paroxysmal nocturnal hemoglobinuria, folic acid, bone marrow transplant, prednisolone, eculizumab. Polycythemia vera treatment, phlebotomy and aspirin prevent thrombosis, hydroxyurea, allopurinol or rasburicase. Antihistamines, essential thrombocytosis treated with hydroxyurea, treatment of erythromyalgia, aspirin. Teardrop cells are found in myelofibrosis, treatment of myelofibrosis, initially with thalidomide, lenalidomide, allogenic bone marrow transplantation. All rods are found in AML. Other bone marrow transplantation can cure chronic myelogenous leukemia, treatment of myelodysplastic syndrome, transfusion, erythropoietin, ecacitidine or decitabine, lenalidomide, bone marrow transplant under age 50, adverse effect of chemotherapy, doxorubicin, cardiomyopathy, vincristine, neuropathy, bleomycin, lung fibrosis, cyclophosphamide, hemorrhagic cystitis, cisplatin, renal toxicity, neurotoxicity, ototoxicity, presentation of multiple myeloma, bone pain with hyperuricemia, anemia, renal failure, hypercalcemia, renal failure and infection are common cause of death in multiple myeloma. Benz-Jones proteinuria in multiple myeloma are detected by urine immunoelectrophoresis. Treatment is melphalan in older fragile patient in multiple myeloma plus BMT. Before splenectomy in TTP, always give vaccine if Neisseria meningitis is there, if H. influenza is there, if pneumococcus is there. I have written the vaccination schedule for children. Okay, at birth, BCG, hepatitis B. Just remember B and B. 2 months. In 2 months, we give oral polio, DTP, HIV, hepatitis, DOHH. In 4 months, same like above, DOHH. 6 months, DOHH, same like above. In 12 months, we give MMR. 18 months, DOH. Okay, oral polio, DTP, and HIV. In 4 to 6 years, DOM. That is DTP, oral polio, and measles, mumps, rubella, MMR. So here we finish hematology and other associated. So here we comes to neurology. So what is there in neurology? Let's see. The risk factor for stroke is hypertension, hyperlipidemia, tobacco smoking, and diabetes with MI. Sudden blockage in the flow of blood to the brain. Carotid stenosis also causes stroke. Presentation of stroke. Middle cerebellar, weakness or sensory loss on opposite side, homominous hemianopsia. Loss of visual field on the opposite side of the stroke. Aphasia is speech disorder. Presentation, anterior cerebellar, personality disorder, urinary incontinence, leg more than arm weakness, means there is a leg weakness is there. Posterior cerebellar artery stroke, ipsilateral sensory loss, 7, 9, 10 cranial nerve, contralateral sensory loss, limb ataxia. Diagnostic is CT without contrast initially, accurate is MRI. TPA is used up to 4.5 hours. If patient age is less than 80 years, stroke and scale less than 25. If patient is non-diabetic, no previous history of stroke. Treatment is thrombolytics, aspirin, statins. Thrombolytics is used less than 3 hours and aspirin more than 3 hours. Catheter retrieval of clot in stroke is useful up to 8 to 12 hours. It is clot removal, not angioplasty. Less than 8 years, no diabetic, no history of previous stroke, less than 25 NIH scale. Thrombosis in stroke, heparin followed by warfarin. Patient foramen ovale closure is done in addition to platelet therapy. It is detected by right left shunt by bubble therapy that indicates closure. Control of risk factor of stroke, diabetes, HbA1c less than 70%, hypertension control, reduce LDL less than 70, tobacco smoking should be stopped completely. Headache, pseudotumor cerebri associated with obesity, venous sinus thrombosis, oral contraceptives, vitamin A toxicity, mimics brain tumor with nausea, vomiting and visual disturbances. Physical exam reveals papilledema with diplopia, cluster headache, rhinorrhea with red eye, sometimes associated with Horner's syndrome. Temporal arteritis, physical exam, visual loss and tenderness of temporal area, elevated ASR, accurate test is biopsy. Diagnostic is pseudotumor cerebri, should be ruled out. Intracranial mass by CT or MRI. LP, that is lumbar puncture, very important, that shows increased pressure. Treatment of giant cell arthritis. Prednisolone, treatment of pseudotumor cerebri, weight loss, acetazolamide, decreased production of CSF. Trigeminal neuralgia, disorder due to fifth cranial nerve. Oxacarbazepine or carbamazepine, medical. Surgical decompression is surgical treatment. Post-herpetic neuralgia, pain after herpes zoster lesion. Treatment with antiviral agents, acyclovir, famciclovir, also treated with TCA, that is tricarboxylic acid derivatives, gabapentin, pregabalin, carbamazepine or phenytoin, tricarboxylic antidepressant, carbamazepine or phenytoin after TCA for the treatment of post-herpetic neuralgia. Zoster vaccine is indicated in all persons above the age of 60 to prevent herpes zoster shingles. Seizures. Seizures is associated with hypocalcemia, glycemia, natremia, magnesemia. Hyper, natremia, CNS infection, abnormality, uremia, hepatic failure, cocaine toxicity. Treatment of status epilepticus, First, lorazepam, diazepam. If seizure persists, phenytoin, phosphenytoin. If seizure still persists, give phenobarbital. Lately, neuromuscular blocking agents are intubation. Absent seizure occurs more often in children. Drug used for seizure in pregnancy safest. Levetiracetam, lamotrigine, ethosuximide is the best in absent seizure. Subarachnoid hemorrhage. Presentation is headache, stiff neck, photophobia, fever, loss of consciousness in 50% of the patient. Subarachnoid hemorrhage, presentation, headache, stiffness, photophobia, fever, loss of consciousness in 50%. Diagnostic test, best initial test, CT without contrast, most accurate test, lumbar puncture. Xanthochromia is a yellow discoloration of CSF from the breakdown of RBC in the CSF, equal in SAH, that is WBC upon RBC, more in meningitis. WBC is more in meningitis. In SAH, subarachnoid hemorrhage, ECG of heart shows inverted T wave due to excessive sympathetic activity. Treatment of SAH, nimodipine, embolization, ventriculoperitoneal shunt, seizure prophylaxis. Cerebral vein thrombosis mimic SAH, presence with clotting in cerebral vein, headache over several days, weakness and speech difficulty, normal LP. Most accurate test is magnetic resonance venography. Treatment is low molecular weight heparin followed by warfarin. Subacute combined degeneration of the cord is due to vitamin B12 and neurosyphilis, and position and vibration sensation lost. Sphincter function are impaired in spinal trauma. Treatment is glucocorticoids. Pain and temperature sensation lost in the contralateral side of injury, plus positional and vibrational sense on the ipsilateral side of the injury. Brown-Sequard syndrome, that is Brown-Sequard syndrome. Syringomyelia, fluid filled dilated central canal in spinal cord due to tumor, trauma or congenital presentation, loss of pain and temperature bilaterally across the upper back and both arms. Diagnostic test, treatment, accurate MRI. Treatment is drainage of fluid from cavity and surgical removal of the tumor. Brain abscess spread from contagious infection. Presentation is headache, nausea, vomiting, fever, seizure and focal neurological deficit. Diagnostic CT or MRI. Treatment is penicillin plus metron plus ceftriaxone or cefepime while waiting for culture results. Vancomycin can be used instead of penicillin. Cafe au lait spots, meningioma, glioma, caught hyperpigmented lesion are seen in neurofibromatosis. Surgical treatment, surgical depression of 8th cranial nerve in neurofibromatosis. Port wine stents of face is seen in Sturge-Weber syndrome. Skull X-ray shows calcification of angiomas. Best therapy for essential tremor is propranolol. This is an end to today's lecture. The DHA GP notes, extracted version of Master of the Board. I hope you liked it very much, and please wait for few more lectures which are yet to come, and I will be presenting you those lectures in few days. Thank you so much.